Scoliosis definition. What is considered to be a scoliosis? When we look at the normal anatomy and structure of the spine, we know the spine is supposed to have some normal curvatures, and there are some natural curvatures that make the spine stronger and flexible and better to absorb mechanical stress occurred during activity and gravity. And in order for a spine to function optimally, its natural curvatures need to be in alignment, and these curves are typically from the side. And there's normally a forward curvature in the neck, a curve facing to the back and the mid-back, and the curve facing forward in the lumbar back and the lumbar spine. And these are called the normal sagittal alignment. Scoliosis is when the structure of the spine involves a development of an unnatural sideways curvature that you can see from the front. In order for it to be considered a true scoliosis, the unnatural curvature must have a rotational component. And typically the rotational component is into the concavity, so a scoliotic spine doesn't just bend to the side, but it also has a twist. And it's this twist, like I said, makes it a three-dimensional condition. In order for a curvature to be considered a scoliosis, it must have a measurement of a Cobb angle of at least 10 degrees or greater. And this Cobb angle is measured on an X-ray that you can use to determine if a patient has scoliosis. The part of the diagnosing of scoliosis also involves classifying the scoliosis upon key condition-based variables like patient characteristics like patient age, the type, the severity, and the curve location. Now, the patient age is very important because we know scoliosis affects all ages, and it's most commonly diagnosed in adolescents between 10 and 18. And the reason why it's most commonly diagnosed in adolescents between 10 and 18 is because this is when scoliosis has the most risk for progression, and the progression is growth. Growth is the number one trigger for progression for a scoliosis. So that's why patient age can help us to dictate when it's most likely to progress. This type of scoliosis is typically called adolescent idiopathic scoliosis, and it's by far the largest group of scoliosis patients that exist. Now, patient age also plays a factor whether a scoliosis is likely to be painful. In children, we know in kids, especially adolescent scoliosis, kids are growing and developing around the scoliosis, so the scoliosis tends not to be a painful condition. However, once skeletal maturity has achieved and the person moves into adult form, the curve is still there, but now it's compressing as a result of gravity. So we know in the adult form, they're more likely to experience pain. Now, the second thing is determining the type of scoliosis. Now, like I mentioned, the most common type of scoliosis is something called idiopathic scoliosis. This means unknown cause. So these are otherwise normal, healthy people, but for whatever reason, they've developed a scoliosis. And we believe the scoliosis typically develops during juvenile years. Something happens that causes a curve. It progresses relatively slowly until growth, and then during growth, it has a chance of progressing quickly. Now, even though there's no single known cause for scoliosis, we believe scoliosis to be multifactorial, meaning there's many variables and many factors associated with their scoliosis, and somebody could have more than one factor associated with why they're developing scoliosis. Now, outside of idiopathic scoliosis, which is about 80% of cases, we do know that the other 20% of cases are associated with known causations. And these could be associated with an underlying pathology, something like a neuromuscular problem, and that's when a patient has a neuromuscular disease that could possibly be associated with the development of scoliosis. It also could be associated with something called congenital scoliosis, where they have an abnormal vertebra in the spine that happens during birth. That could be a result of their scoliosis. Or it could be something like degenerative scoliosis that occurs in later stage adult life as a result of some type of injury or problem to the spine that's caused that area to degenerate faster than the rest of the spine. That's what we call degenerative scoliosis. Now, treatment plans must be shaped around the underlying cause so that it can be completely effective. And there's different treatment plans associated with the different associated types. The severity levels is also something to consider. We know scoliosis can range widely in severity, and the severity is based upon the size of the Cobb angle. Now, a Cobb angle only looks again, a measurement of x-ray. So when they classify scoliosis as a mild, moderate, severe, or very severe scoliosis, the only thing they're considering is the size of the angle measured on the x-ray. They're not considering how the patient's being affected with the scoliosis. Is it causing pain or not causing pain? The Cobb angle severity also is related whether a patient qualifies for surgery or not. So these ranges or categories are surgical categories, meaning if somebody is diagnosed with a mild scoliosis, what they're saying is the curve is too small to consider surgery. If somebody has a moderate scoliosis, they're again saying the curve is too small to consider surgery. As they move into severe and very severe, that's when they start consider surgery. Now, patients with mild scoliosis may have severe effects, meaning pain or malfunction. Patients with severe scoliosis may have very little effects as a result of scoliosis. So we know it's not necessarily the severity of the scoliosis that dictates the effect on the body. It's how the curve worsens and when it worsens that's mostly affected. Now, the size of curve will affect our treatment plan. So in conservative treatment options, we know as curves get bigger, some different things need to be done versus mild curvatures. Now, one of the last things to consider is where the curve is located. There are three main sections of the spine we call a cervical spine, thoracic spine, and lumbar spine. Scoliosis can develop in any one of these sections, and it can develop in more than one section. So people can have a curvature in between two sections, or they can have two curves in two different sections. So there's no limitation. However, most patients will have three or more curves. Most patients don't have one curve. Even though when they're diagnosed with you have one large thoracic curve, typically the patient will always have counter curves in the opposite direction to balance themselves out. So even people that are diagnosed with something called like a C curve and they say it's one large, they always have counter curves. I've seen many, many curves in one single patient. In fact, typically 5, 6, or 7 curves is not uncommon, but these are smaller compensating curves, not the main large one. Typically, where the curve is diagnosed is where the apex of the curve lies. So the apex of the curve is the most horizontal vertebra in between the most tilted vertebrae. If that most horizontal vertebra is in the thoracic spine, they call that a thoracic curve. If it's in the lumbar spine, they'll call it a lumbar curve. If it's in between the two, they'll call it a thoracolumbar scoliosis. And if it's in the neck, they'll call it a cervical scoliosis. The curve location really helps me determine how to focus my treatment efforts so we can deliver the very best results possible in resolving and reducing scoliosis. Also, we know certain patterns are associated with certain areas, meaning lumbar curves most likely tend to go to the left. Thoracic curves most likely tend to go to the right. So we very rarely see a left thoracic curve and a right lumbar curve. And that's because that's the way the body typically moves. And that's what's called a typical scoliosis versus an atypical scoliosis. Atypical curvatures tend to be more associated in other types of scoliosis other than idiopathic. So a neuromuscular scoliosis or a congenital scoliosis is more likely to have a scoliosis bending in the opposite direction that I just mentioned. Now, even though there's a number of spinal conditions that involve loss of healthy curvatures, we do know the complexity of scoliosis sets all those conditions apart. It sets scoliosis completely apart from those, because not only can scoliosis affect the normal sagittal alignment, it affects the frontal alignment, and it also has a twist, which makes it a three-dimensional condition. And because of this complex presentation of scoliosis with all these variables, a complete program that must be customized for each and every patient must be developed. And typically, the earlier the scoliosis is treated in its progressive nature, the better results we're going to see. So here at Scoliosis Reduction Center, we definitely recommend early detection, early treatment, customized program to deliver the best results possible. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.